students, welcome back. Now we are going to see the nerve supply of the lungs. The nerve supply of the lungs is done by both parasympathetic as well as sympathetic. So the parasympathetic nerves are derived from the vagus nerve. So this is the vagus nerve. So this is derived from vagus nerve. These fibers consist of motor, secretomotor and sensory. It is having motor function, and these fibers also having some secretory function to the mucus glands of the bronchial tree, and also it is having some sensory functions. So now we will see all these things. The fibers which are motor supplies to the bronchial muscles, that means bronchial tree. So the muscles which are surrounding the bronchi or the smooth muscles, so those muscles are supplied by this parasympathetic fibers, motor fibers, and on stimulation of these motor fibers causes bronchospasm. That means constriction of the bronchi. What is happening? Constriction of the bronchi taking place. So if you take, this is the bronchus. So if the size of this diameter decreases, then this one is the constriction of the bronchus, called as bronchospasm. So the bronchospasm is caused by the stimulation of the vagus nerve, that to motor fibers. Now coming to the secretory motor, this secretory motor is supplied to the mucus glands of the bronchial tree. So these mucus glands are present in the epithelium, inside the lining of this bronchi will have some secretory glands or mucus glands. So those are stimulated by the secretomotor fibers of the vagus nerve, and because of this stimulation it will secrete some mucus inside the bronchial tree. Okay, and also sensory. So these sensory fibers are mainly responsible for the stretch reflex of the lungs, and also helps in cough reflex. So the cough is caused by the stimulation of the sensory fibers of the parasympathetic nerves, which are derived from the vagus. Okay, now coming to the sympathetic fibers. So sympathetic fibers, so here you can see all these are the fibers, spinal segments nunchi vache fibers. So all these fibers form, each fiber will have a ganglion. This is called as the sympathetic chain. Okay, so the sympathetic nerves are derived from the spinal cord, segments from T2 to T5. From T2 to T5 is which are supplied to the lungs or of sympathetic nerves, and these are inhibitory to the smooth muscle and glands of the bronchial tree. That means this parasympathetic nerves causes bronchospasm, constriction. If the space is decreases, the air will not move out freely, and they cause some difficulty in breathing. So in such a case, what will happen? These sympathetic nerves are stimulated, and these will have an inhibitory function to the smooth muscles and glands of the bronchial tree. That means which causes bronchodilation. So it will increases the space, so which causes bronchodilation. Okay, so some of the drugs like adrenaline, so which relieves, and also sympathomimetic drugs. So these two kinds of drugs are used in bronchial asthma and relieve that breathlessness, because these drugs cause bronchodilation, and airway is improved in those conditions. Okay, and both parasympathetic and sympathetic nerves first form the anterior and posterior plexus, which are situated in front and behind the hilum of the lung. So, and these flexes, from these flexes, nerves are distributed to the lungs along the blood vessels and the bronchi. So, along the blood vessels and bronchi, these flexes also give small branches. That means it forms a course like vein, artery, and nerve, like that. So, it will also, through with the help of bronchi and the blood vessels, these nerves are also supplying to the lung. Okay, so this is about the nerve supply of the lungs. Thank you.